CT temporal bone. Clinical indication. K.C. left CSOM since childhood. Left-sided ear infection for 3 months with left ear discharge, left molar gum swelling, restricted jaw movement with decreased hearing and left facial pain. Positive ENT symptoms. Technique. 2.0 mm reconstructed images from a scan performed on multi-slice CT scan, reviewed on workstation using different window and level settings. Non-contrast CT temporal bone is performed according to departmental protocol. Findings. Right mastoid air cells are clear. Right middle and inner ear structures, including internal auditory canals, cochlea, semicircular canal and auditory ossicle are intact. Right external auditory canal is clear. Right tympanic membrane and scutum are intact. There is complete opacification and sclerosis of left mastoid air cells. Opacification of middle ear cavity is also seen around auditory ossicle. There is no ossicular erosion. Tympanic membrane is not visualized, likely perforated. External auditory canal is clear. Scutum is blunt. Pharyngeal opening of eustachian tube and torus tubarius is normal. Inner ear structures including cochlea, semicircular canals and internal auditory meatus do not show any abnormality. Carotid canals are normal. Ica atherosclerotic calcifications are noted. Nasopharynx is clear. Rest of the osseous structures and soft tissues at skull base do not show any abnormality. There is lobulated mucosal thickening in bilateral maxillary, ethmoid and frontal sinuses with complete opacification of left frontal and anterior ethmoid air cells. Mild mucosal thickening is also seen in bilateral sphenoid sinuses. Osteomedal complex is patent. There is deviation of nasal septum towards left with an osseous spur. Cribriform plates, crista galli and lamina populatia are intact. Orbits, eyeballs and rest of the orbital contents are normal. Visualized brain parenchyma does not show any abnormality with limitation of soft tissue window. There is no tonsillar herniation. Impression. Complete opacification and sclerosis of left mastoid air cells with almost complete opacification of middle ear cavity, perforated tympanic membrane and blunt scutum. Consistent with patient's known left chronic suppurative otitis media. Clinical correlation is recommended to rule out possibility of cholesteatoma. Sinus mucosal disease with complete opacification of left frontal and anterior ethmoid air cells. DNS towards left with an osseous spur.